Hello, my name is Anna Sulia. I am a doctor of physical therapy and owner of Inertia Physiotherapy here in Missoula. Thank you for listening to this episode of Missoula Health and Wellness Conversations, a video podcast where I sit down and chat with local health experts in the Missoula area about their business, the services they provide, what inspires them to do the work they do, how they've adapted to serving patients in the era of COVID-19, and any other topics that seem to catch our interest along the way. My goal with these conversations is to get to know local providers so I can help foster a network of caring practitioners and help the people of Missoula live their best lives. If you are interested in the services at Inertia Physiotherapy, please visit our website at www.inertiaphysiomt.com or call 406-880-7945. Refer to the video or the show notes to contact our interviewee of the day. Without further ado, I hope you enjoy this week's episode. Okay. Hello, welcome to Missoula Health and Wellness Conversations. Today I have Moua, a nurse practitioner, Montana native who enjoys cooking, gardening, and the outdoors. She works full-time as an addiction, but also has recently launched her very own business working in aesthetics and wellness. And she treats headaches and migraines with Botox, as well as does some aesthetics and that I'd like to hear more about. And then also some hormone replacement therapy, which I'm also interested to hear about. Ka and I go way back.
Way back.
Way back. Target range tigers together, and then Big Sky Eagles, and then we kind of lost. We didn't, kind of went our separate ways. But I'm excited to kind of catch up with you, and coming back together in our, if I dare to say, 40s.
I know, don't.
How did that happen, right?
Yeah.
I feel like it was like yesterday, but
Yeah.
I'm excited to see what you're doing and learn more about what you're been up to in your business.
Yeah, no, thanks, Anna. Thanks for having me here. I've been I worked in primary care for quite a bit with the VA. Spent a lot of when I first started out, I was in chronic pain for quite some time. And that's where I started out doing the Botox for medical stuff. So TMJ, migraines, and spasticity. And then eventually got onto the cosmetic side for the last 3 years. So now I've just kind of blended the two together because I do really enjoy um, chronic pain is a tough disease process to work with, and it's rewarding to, I always tell my clients, we can never take away all your pain, but if we can decrease their pain so that they can continue to have a better quality of life and be able to function, that's the ultimate goal.
Yeah, I think I would second that. Kind of improving function is the primary goal, and reduction of pain is certainly also a goal. But when you actually talk to somebody, they want to be out of pain because, right, I want to be out of pain so that I can enjoy more time with my kids or my grandkids, or go to work and make a paycheck. And those kind of next level things are almost more important for a lot of folks.
Yeah, I agree.
So as far as Polaris, what is you're a busy lady. I know you have some hours here, and you're mobile, is that right?
So I'm mobile, so I can see patients in their homes, usually in the evenings, and then on the weekends. I have a clinic here in Missoula at the Beauty Lounge. I'm usually there on Fridays, and then I rotate my Fridays. I'm here in Missoula and then also in Dillon. But yeah, I'm mobile. I can come to patients' homes or office, and sometimes I'll just rent a room and see clients too. So I
Gotcha.
travel. Yeah, it's been fun.
Nice.
I enjoy it. Yeah.
Yeah. So what types of people seem to be kind of accessing your services?
You have the one for just general aesthetics who just wants to, as we age, it's more preventative. So I have clientele that wants to prevent the wrinkles. And I think when it comes to Botox cosmetics and stuff like that, we've come a long ways, whereas 10, 20 years ago, no one really talked about Botox for wrinkles. But nowadays it's become mainstream. And so, I get men and women that come in and want to do preventative measures to reduce wrinkles. And then I do get those with medical issues. A lot of them are chronic pain that come in for some pain relief. So in that area, I do joint injections. So I'll do joint injections with steroids, and I also do joint injections with PRP. So that's kind of,
Okay.
their evidence shows, studies have shown that there are some relief with that just because of the um, platelet-rich plasma, because there's growth factors in that. So I've been
Yeah.
dabbling in some of that. I'll also do trigger point injections for my clients. And along with that, there's percutaneous electrical nerve stimulation that I found beneficial to clients, especially with chronic myalgias or fibromyalgia that seem to get good pain relief too, along with
Interesting.
the Botox for migraines and stuff.
Yeah.
Yeah.
So let's talk about the plasma-rich protein a little bit more too, because that's, I know, something that is that a service that's covered by insurance, or is that something that people are pretty much paying out of pocket for these days?
Right now, because that's not FDA approved, it's pretty much out of pocket.
Gotcha.
Yeah.
And does that apply to like any joint in the body? Or are you treating specific joints more than others?
Um, it's any joint that you would normally go in to do a steroid injection, you can go in and do a PRP injection. Um, yeah.
Do you find that more or less successful, or people kind of, how do you choose one versus the other?
I think it's just educating the clients on what they want. I think both of them can be as successful. Those that have probably done steroid injections that haven't gotten a whole lot of relief may want to trial the PRP. Those that haven't done steroid injections but maybe want to go a more natural way instead of putting steroids in their system might opt to do PRP.
Gotcha.
Yeah.
And does the PRP, is that a single shot sort of thing, or is that something that people have to do kind of successively to
You're
get
going to need a
relief?
couple of treatments, at least 2 or 3 treatments
And
for
how far apart are those usually
I
done?
would probably recommend 4 to 6 weeks.
Okay.
Yeah. And then the
Yeah.
steroid injections, those are usually about 3 months apart.
I feel like we have a family friend who I think did PRP injections, and I think in her knees she was having some pretty severe arthritis in her knees, and I think they made her sort of rest, kind of legs up for a couple of days or 3 weeks. Is there a sort of protocol following those injections that you tell
Yeah.
people to do?
There's not, oh, yeah. I mean, you want to rest. You might have some stiffness and some swelling, but yeah, definitely rest for a couple of weeks before, you get mobile again.
Yeah. And what is the main sort of action that the PRP does? Because the steroid is really, I always tell people the steroid is sort of like you have a significant amount of inflammation, and it's like you have to call in the fire department to put out your fire because your like garden hose isn't doing it. Like your anti-inflammatories oral aren't really getting there, or they're just not strong enough to really do it. And so the steroid really just goes in and really puts the fire out quickly if it's an inflammatory process. How would I describe like a PRP like process to my clients if somebody was asking me?
I think so steroid helps with the inflammation, whereas PRP is repairing. So
Okay.
you have the growth factors that are repairing. So it is going to take time. It might get worse before it gets better. Whereas the steroid, it takes 2 to 3 days for the steroid to start working. And then the pain starts to go away. With PRP, the growth factors, they're repairing the trauma. And so it might get worse before it gets better.
Gotcha. Is
Yeah.
there a group that you sort of see those be more successful in? Like, um, someone with like a minor meniscus tear in their knee versus like a major sort of
I would
bone
say,
on bone
yeah. I would say
situation.
the less trauma, they're probably a better candidate for it, but it never hurts to try on the more chronic ones too, because
Sure.
everybody responds a little bit differently.
Yeah.
Yeah.
Interesting. Um, and then headache clients that come in are do you probably see a variety of people, migraine, tension, um, cluster, like all the different types of headaches? How do you approach your headache clients?
So a lot of my headache clients come from either referrals from their primary or their neurologists. So your insurance will pay for you're probably 98% of the patients who have insurance. Their insurance probably will cover for their Botox injections, for their migraines. You have to have failed medications, and then we just have to document that. But it's FDA approved, and you just have to have at least eight migraine days a month, with 15 headache days and lasting more than 4 hours. If you meet that criteria, then you qualify along with having documented failing medications. So when we start the Botox injections, oftentimes it's recommended that we always repeat the second one. I inject the Botox in the 7 key areas of the muscles. So it's in your head and neck muscles. And it's pretty much 31 injection sites, but it's in 7 major muscles. And so oftentimes when I first see clients, if their migraines are really inflamed and they're really having severe migraines, it can also trigger, and migraines and headaches make it worse. But I always reassure the clients, like, even if you don't get any relief or some relief, it is recommended that we always just repeat the second round. And so when we do this, it's about 12 weeks later. And so we'll always do the second round of injection to see if they are a good candidate. And after the second one, if they're getting relief and having improved quality of life, then we just continue doing maintenance Botox injections every 10 to 12 weeks moving
Gotcha.
forward. After the second injection, if they're not getting any improvement, then they're probably, not going to be good candidates to continue with Botox.
Gotcha.
Yeah,
I mean, if you're talking about the sort of different types of headaches, like migraine being more vascular, tension being more like, stress and tightness, do you find like what is because I guess I haven't looked into the research that much recently. Migraine headaches kind of just trying to take the intensity down with the
correct.
like reduced tension and the reduction of muscle tone around the
Yeah.
head and neck.
Yeah. And I have found, I've had a couple of clients with so Botox, so it is recommended for just migraine and headaches. But I've had clients where like they've just have cluster headaches and it's really severe. And at first I was kind of hesitant, but after a couple of treatments, he actually got really good relief. So I think if your headaches and your migraines are that bad and the meds aren't helping, it's at least worth it to try
Yeah, to give it a
Botox.
try.
Hmm. Yeah.
Um, do these clients that you have, I mean, migraine comes from so many different sources, whether it be, a food sensitivity or hormonal or maybe some gut health issues as well. Um, do your headache clients tend to have sort of more of that kind of history of headache, or are you getting people that are more like maybe history of whiplash, history of concussion? Like, is it kind of a mixed bag of?
I think it's a mixed bag. I think by the time I get to them, they have pretty much, by the time they're referred to me, they've failed everything. They've tried everything, whether it's,
Yeah,
changing their eating habits, or whether, the trauma ones are usually, there's not much you can do after that. But a lot of them are just, they've changed, they've tried to do lifestyle changes and it's not getting better. And so Botox is kind of like their last resort. And a lot of
gotcha.
people actually out there don't know that Botox is FDA approved for migraines, and headaches. So when they do find out, they're like, I wish I would have known. So,
Yeah, for sure. Because I feel like definitely going through physical therapy school, I think maybe they were talking about it, just the like a tiniest mention of
mhm.
that, but I don't know how long it's been approved. So I'm like, how long ago was that? Was it maybe early or maybe not yet? And then mostly they were talking about using it for, injection for like spasticity and like kids with cerebral
Yep,
palsy and things
yep,
like that.
yeah, absolutely. Yeah, I mean, Botox is pretty much well studied, and I think it's been studied in more clinical trials than any other preventative medication. Um, and I want to say, like, I think I read the other day that there's like over 3.5 million Botox treatments have been given over to like 500,000 people. So it's
Wow.
working. And, when I first started it, I was kind of skeptical, like, okay, what is this really going to do? But, my clients keep coming back and they're just grateful
Yeah,
that there's treatments available. And that's why I continue doing it because they do have an improved quality of life. And are able to function in and participate in life events that sometimes you and I take for granted.
for sure.
So
Do you find that those clients are ever able to get off? Like if you said they've mostly failed medication or maybe the medication hasn't really given them a full solution. Do they ever get off medication or
some
are
can,
they
some can, and if they do, I usually refer them to just, work closely with their neurologist to taper off some medications. And some of them don't really, they still have their, um, abortive medications to use in case, they have a major migraine. But a lot of them end up, if they're taking tons of ibuprofen before, they do come back and say that they're not taking as much anymore. So some may get off meds, or some may just reduce their use of medications that they've been taking. But Botox is more of it's complementary into what they're already doing, and not something that if Botox helps, then we discontinue all the other meds.
gotcha.
Yeah,
Interesting. Yeah, that's I think that's a really good resource for people to have because headaches can be really debilitating for
yeah,
people. And
absolutely.
I find a fair amount of I kind of have dove into some work where I get more specific on treating the nerves, especially the suboccipitals, and kind of, I used to put my fingers up there and think, oh, I feel tight muscles, and now I actually feel like, oh, that's like it's like a really tight nerve, and kind of those greater occipital nerves that can
Yep,
kind of wrap up
yep,
over the head. But and that stuff definitely helps, and I feel like I can help more people with headaches with those skills than maybe I did in my earlier in my career. But there are those people that just seem kind of intractable, kind of, and
yeah,
they get really shut down when they just can't get relief.
yeah,
So it's great to know that that resource is in the community.
yep.
So, and you said about every 10 to 12 weeks ends up being the treatment.
So I
Do
find
you-
that those that are, yeah, if you're a fast metabolizer, you might need it sooner, like between 8 to 10 weeks. But on average, it's about 12 weeks. That's usually when the Botox starts to fade again. And so they'll feel their headaches and migraines come back. Sometimes, when your pain is lessened and all of a sudden it comes back, it's probably the same, your baseline pain, but it seems like it comes back with a vengeance. So
Mhm.
then they come back and we just repeat it. So yeah, pretty much it's 12 every 12 weeks maintenance for Botox moving
Nice.
forward.
And how do you incorporate the use of trigger point injections? Because that's a whole different thing, right? You do use
Yeah.
like a lidocaine solution or
So I use lidocaine with saline, and then occasionally, if my patients are really flared up the first couple of times I meet them, I'll also put like a low dose steroid in there just to kind of calm everything down. Yeah.
gotcha.
So you can do that separately, or I've had patients combine it with the percutaneous electrical nerve stimulation, where I just put in. So basically, the trigger points that I find on the client, I hook them up to the little acupuncture needles, and it's just a low current. It's about 20-minute treatment. Just to kind of trigger the nerve pathways to change their directions. And then I'll go in there and do the trigger points on top of that after their treatment.
Gotcha. So
Yeah.
you're doing needle insertion for
Mhm.
the electrical stimulation
Correct.
and
Yep.
then following that with
The
the
trigger points.
injection.
Yeah.
Gotcha. Yeah, I've done the kind of dry needling and then the stimulation
Mhm.
in that, just kind of getting a little more of that whole muscle contraction. And I feel like, if you don't get the needle exactly in the trigger point, you kind of capture a little more of
Yeah.
the bundle because you get
Yeah.
that kind of contract, relax, sort of clear the parking lot of the acetylcholine that keeps the contraction. People tend to respond to that a little better than the like repetitive stabbing
Yeah.
with a
I
needle.
agree.
That's like,
Yeah.
ouch.
Well, I'm like, if you're gonna dry needle me, you might as well inject me with something, you know?
Right. Yeah. So that's the dry needling, they say for some people it works equally as well,
Mhm.
kind of just getting that relief of that local muscle tension. But it's kind of the ones that keep coming back
Correct.
that are a little more tricky. So, um, do you feel like so it's following that with more of the wet injection or the actual trigger point injection
It
seems
kind of
like a good
depends on the
combo?
patient. Like if they just want to start off with trigger points, then we can just do trigger points. If they want to just, because you can do them together or you can do them separately. Some just want the pens and not the trigger points. Some want, trigger points. So it just kind of depends on patient and what they're comfortable with. A lot of them, if they've always just done trigger points, the acupuncture needles and the whole idea of a current stimulating kind of scares them, then we may just start with trigger points and kind of see how they're tolerating, and then do maybe a session of a pens treatment on top of that. But usually if a person's pretty flared up when they come in, the recommendation is weekly treatments for about 4 to 6 weeks, and then twice a month treatments for about 4 to 6 weeks, and then just monthly for maintenance. And then when they do have a flare up, you just kind of go back to weekly or every 2 weeks depending on how the patient's feeling.
So it sounds like so those treatments, I feel like a lot of times patients come to me and they've gotten injections and they obviously give them a decent amount of relief, especially if they hit sort of the right ones.
Right areas. Yep.
But the problem that I run into is that they often come back. Um, and I mean, certainly it's not my area necessarily, but it seems like there aren't as many people doing them that kind of repetitively,
Yeah.
or like keeping up with it to kind of keep that muscle tone down.
Yeah.
Do you find do you ever kind of refer these people or get these people thinking about kind of I mean, fibromyalgia is a whole nother sort of like root cause issue that's
Yeah.
highly trigger point, but the people that are more like, have muscle imbalances or postural habits and things like that that drive trigger points, do you ever refer those people to be maybe working on it from the corrective angle as well as the sort of
Yeah.
suppressive angle?
So, yeah, I mean, after a few treatments, if it's not working, I'm not going to continue the treatments, but I do refer them either to chiropractic, physical therapy, massage. So, definitely it's one of the modalities that they should be doing, because if there's something functioning wrong with the body, you can do trigger points or pens and it's going to provide temporary relief, but you're not doing anything to really fix it. So if it is,
Right.
a truly functional issue, yeah, I will definitely refer them to physical therapists, chiropractic, massage, and all that.
Yeah.
Yeah,
I think that's like, it's nice to have these conversations partly because it's like, it's good to know who and where we can send people for
absolutely.
complementary services so we can make sure that people are kind of getting it from all ends because ultimately, like you said before, the ultimate goal is just to make sure that they're as functional as possible,
Correct. Yeah.
so they can get
It's,
back to doing what they need to do.
yeah, it's a chronic issue, and you and I deal with chronic issue and pain all the time. But, if a treatment can lessen their pain for a couple months, it's the little victories that we live for.
For sure.
Yeah.
Yeah. Yeah. Because I think there are people that I see where, I can kind of like get them to a good place in 6 to 8 sessions or maybe 12 sessions. And then they kind of go off and maybe they come back if they hurt something else. And then there's certainly the people that are a little more like, I mean, I do maintenance related things as well. Like
Yeah.
feel a little bit better if they kind of get tuned up, once a month or even every other week or every 4 months or whatever that kind of works for that
Yep.
individual.
Yep.
I think it's an interesting conversation just from the quote unquote wellness,
Yeah.
because wellness we don't pay for in
Exactly.
healthcare,
Yeah.
right? Which is unfortunate because I feel like if you're investing in wellness, you're less likely investing in illness. Um,
Absolutely. Yeah.
and so I feel like a lot of people don't seek services until they're so broken that it's like this giant hill to dig out of.
Yep.
So, and that's kind of it's kind of unfortunate, but I think that's kind of how we've been trained too.
Yeah.
Like suck it up and keep moving forward until you can't.
Yep.
And
No,
then
I
let's try.
totally agree with you. Yeah. Yeah.
Yeah.
It's like, unless it's broke, you just keep going. Whereas, if we can all do more preventative stuff to help from breaking, that is the part of the preventing illness,
Right.
part of the wellness portion is just, maintenance type stuff that we should probably all be doing, me included, that we
Mm-hmm.
don't do. You take, it's like, well, I'm feeling okay today. Or you have these little ailments that are going on and you're not really addressing them. And then one day it just gets to be really bad.
Yeah. It's like
So
life, maybe you pick up a new workout routine and that overloads you, or your work gets really stressful, or your kid doesn't sleep well, and it's like that like last straw on the pile that sort of sets off this, where did this come from? And you're like,
yeah,
well, it's probably been brewing for a while
yeah,
actually.
years and years. Yeah.
Years and
No.
years. But and I feel like now is kind of the age where we're starting to feel those things catch up to us. Like
Yeah, and for 40, yeah, you just wake up one day like rolling out of bed, without any pain is a victory, who knew?
right. Yeah. So yeah, well I think it's great that you kind of out there and taking this mobile, and especially during COVID, I imagine that was beneficial for you and for people to kind of be going to someone, because a lot of people were kind of afraid to enter a bigger facility.
Yeah. Yeah, and I come from background of home health and hospice, so I'm comfortable going to patients' homes. And so yeah, and especially when you throw COVID on top of that, it's like, why wouldn't I go into patients' homes? Make sure they're comfortable and reduce the risk. So yeah, it's good to be mobile.
Yeah. Is this sort of is Polaris sort of just going to be kind of your pet project, or do you feel like it'll get bigger? Like, do you have like a 5-year vision for your career?
Right now, it's just a pet project, but I'd love to be able to do it full time down the road sometime. But I do really love addiction too. So I'm just, right now it's just good balance,
Yeah.
for me.
Do
So,
you take any of those things do you take any of the skills that we've talked about and put those into, does that apply to addiction therapy?
it does. I mean, most of my clients, everybody has different issues. So, although I'm just helping them with their addiction, I can definitely refer them out if they've got, because a lot of them, you know, aren't in primary care, or, their addiction is their priority. And maybe, a lot of them are chronic pain. Um,
Mm-hmm.
so it's like, let's try to treat the pain so that it reduces, the risk for you, the client, to relapse and all that stuff. So yeah, definitely, it's something I talk to my clients about. And then I encourage them and I refer them out, or encourage them to reach out to resources that can help, lessen their pain, or if there's other interventional procedures or modalities to help with their chronic pain issues.
Yeah, because I would imagine that there's a decent number of folks that you run into that they're self-medicating for a variety of reasons. But
Yeah.
I mean, pain has to be at least in the top 10,
Oh,
if not
absolutely.
higher.
Yeah, I would say top 10, top 5. A lot of them is, from injury and then surgery and then being prescribed pain meds. And then
Yeah.
now they're addicted to it, and their chronic pain has gotten worse, or just trauma that they've never really dealt with, and just
Hmm.
self medicating with pain meds.
Yeah,
So,
and I think it's interesting. I've kind of getting into more integrative practice and diving into treatments in the visceral system, as well as kind of more specifically in the nervous system, and stepping outside of my traditional box of like musculoskeletal,
yeah,
and learning things about like incorporating some Chinese medicine concepts in the like trauma, and can be stored anywhere,
yeah,
right? So, your chronic neck tightness certainly comes from a variety of angles, but it could be, locked up emotions or trauma that you haven't dealt
yeah.
with. And so, do you ever find people have emotional breakdowns kind of as you're starting to get into these tissues or work with these tissues?
Sometimes, and I think the more you work with them and the more you create trust with your clients, and the
Mm-hmm.
less they give into the treatment, or the more they give into the treatment, yeah, sometimes it creates these emotional, that they've just kind of kept cooped up inside, you know,
Mm-hmm.
and part of, sometimes your pain sensitivity heightens because you haven't letting all that you haven't been able to let that stuff go. So it becomes kind of a, a healing time for patients. And that's where, I can only do so much. I'm not a counselor, where that's where I encourage them to go to support groups, bereavement grief groups, and find, work with their counselor, because a lot of addiction, there's a lot of trauma and a lot of things that clients have not healed from. So they continue to use to mask all that. But it's working, with them along their path. And some are ready, some are not. And some of them don't know when they're ready. And suddenly here they are breaking down in front of you. But I think it's great because it's their journey it's their journey, and it's part of their recovery. So,
Yeah.
yeah.
Yeah, I think it's important to get it at those at whatever angle it can be. And I definitely have, run into people who maybe don't outwardly have a reaction in my clinic, although they can, just sort of spontaneously start
Yeah.
crying when you start working on
Yeah.
certain tissues.
Yeah.
But sometimes it comes back to them in like weirdly lucid dreams and, bringing up memories that they haven't thought about for years, or you start working on a particular tissue and they suddenly like, I remember when I fell skiing on that thing,
Yeah.
15
Yeah.
years ago, I completely forgot, and they get this like flash of memory across their
Yeah.
brains. It's just so interesting how, I mean, all of it intertwines.
Absolutely.
And I
Yeah.
think that it's valuable to have different resources to kind of bring to the table for people. So
Yeah.
it's good to refer out, and it's good to know, what
Yeah.
other complementary services are out there.
Absolutely. And yeah, just collaborating and just knowing what services we all provide so that we can help our patients out.
Yeah.
So
What percentage of your Polaris practice do you think you're doing more sort of medical interventions or with those wellness versus your aesthetics?
I would say probably 70% aesthetics, 30 wellness. But I think a lot of it is just getting the word out and having people
Mm-hmm.
understand that there is, these procedures or these treatments to help with the wellness side of it. And I think hopefully my goal is over time, it'll be like 50-50.
Yeah.
Um, so,
Yeah.
and my whole thing is, if you have wellness, if you feel well, then you're wanting, if you feel well, then you're going to feel better and have a better outlook on life. And aesthetics is just that part of it, is that,
Mm-hmm.
a lot of the clients that get aesthetics, um, it's just, they just want to look a little bit better. It's not no major procedure changes where it's gonna, you know, like Botox, they don't want a frozen face or anything like that. They just want to soften um, their wrinkles, or as they age. So it's all preventative, essentially.
Yeah.
Yeah.
And all of that stuff must be out of pocket payment. Yes.
Correct. So the only
Yeah.
thing I bill for is the migraine stuff. Everything
Gotcha.
else is out of pocket. But when it comes to like TMJ or like trigger points, patients can submit it to their insurance and try to get reimbursement. Right now, it's
Yeah.
just me. I don't have a staff, so I just have to limit like what all I can really do. So
Yeah, for sure.
yeah,
Yeah, I kind of run the same way as I've being just myself out on my own. I've actually elected to more or less, I don't really bill insurance. I've taken on a work comp claim or two.
yeah,
But as far as private insurance, people just pay me up front, and then they can seek reimbursement if their insurance accepts those types of
yeah,
claims.
yeah,
There's a couple of the cases that's not quite that straightforward. But I think that's another, just looking at that angle of trying to treat people who are having real issues and enhance their function, but also be able to more likely support them along their wellness journey.
yeah,
Because insurance doesn't really pay for that. So,
absolutely. Yeah,
yeah.
which is true. Yeah.
Well, awesome. Thank you so much. Is there anything else that you want to share that we haven't covered? Any
No,
other
I think
thoughts?
we pretty much covered a lot, and I look forward to collaborating with you and referring clients to you and vice versa. So,
Yeah, for
yeah.
sure. Well, what is maybe just give people the best way to get a hold of you?
So they can just call me or text me, and my number is 406-239-6734, or they can book online at www.polariswellness.org. Yeah.
Awesome. All
Awesome.
right. Well, thank you so
Thanks,
much,
Anna. I
Ka. It's so
appreciate
good
our
to see
time
you.
together. Yeah, we'll see each other
Yeah.
soon, okay?
Yeah. Thanks.
All right, you
Bye.
betcha. See you later.
Bye.